Have you ever wondered why some people have high cholesterol levels despite leading a healthy lifestyle? Could it be more than just diet and exercise? It's a question that puzzles many. Enter familial hypercholesterolemia, a genetic disorder that takes this puzzling situation and puts it into perspective. This condition, often inherited, leads to high levels of LDL cholesterol, commonly known as the bad cholesterol. Now you might be thinking, what's the big deal about a little extra cholesterol? Well, the stakes are high. Familial hypercholesterolemia significantly increases the risk of heart attacks at an early age. The buildup of LDL cholesterol in the blood can cause blockages in the arteries, leading to cardiovascular diseases. It's like having a ticking time bomb in your body without even knowing it. So, if it's not just about lifestyle, how do we diagnose familial hypercholesterolemia? Diagnosing familial hypercholesterolemia isn't as simple as it may seem. This condition is typically identified through a combination of blood tests and genetic testing. Blood tests are used to measure levels of LDL cholesterol, the type that's harmful to your heart. High levels of LDL cholesterol could indicate the presence of familial hypercholesterolemia, but that's not the whole story. Genetic testing is also used to definitively diagnose this condition. Why? Because familial hypercholesterolemia is a genetic disorder. It's caused by a defect in a specific gene that controls how your body handles LDL cholesterol. If you have this defective gene, your body can't effectively remove LDL cholesterol from your bloodstream, leading to high levels of this harmful substance. Early diagnosis is crucial for managing familial hypercholesterolemia. The sooner treatment begins, the better the chances of preventing serious heart disease. And here's where the role of genetic counseling comes in. It helps identify family members who may also have this condition, enabling early intervention and management. Now that we know how it's diagnosed, what are the signs and symptoms we should look out for? The signs of familial hypercholesterolemia can be subtle, but they are crucial to identifying the disorder early. One of the most common signs of this condition are xanthomas, or fatty deposits that often appear as yellowish bumps under the skin. These can be found on the elbows, knees, or buttocks, and are a physical manifestation of the high LDL cholesterol levels in the blood. Another symptom that can indicate familial hypercholesterolemia is corneal arcus, a grey or white arc or ring that can appear around the outer edge of the cornea. While this can occur naturally with age, in younger individuals it can be a sign of high cholesterol levels. However, it's important to note that symptoms can vary greatly from person to person and may not always be physically visible. Some individuals may show no signs at all until they experience a cardiovascular event such as a heart attack. This is why regular checkups and awareness of your family history are so important. It's clear that familial hypercholesterolemia is more common than we might think. But how common exactly? Familial hypercholesterolemia is indeed more widespread than we often realize. This stealthy disorder affects approximately 1 in every 250 people worldwide, making it a significant public health concern. Its presence doesn't discriminate between genders, striking males and females in equal measure. The survival rate for people with familial hypercholesterolemia can be quite variable. It largely depends on how early the condition is diagnosed and managed, and the individual's adherence to treatment. However, those carrying 2 copies of the defective gene face a steeper challenge. Their prognosis is typically poorer, with an increased risk of early heart attacks, underscoring the importance of early detection, regular monitoring, and stringent adherence to prescribed treatments. In conclusion, familial hypercholesterolemia is a serious and common condition that requires early diagnosis and management to prevent severe complications. Like, share, and subscribe.